Welcome back. Now we are going to talk a little bit more about cystic fibrosis and consider the possibility of passing on the gene to your offspring. So, when considering a husband and wife, both being carriers of cystic fibrosis, what are the chances of having a son that is also affected by the disorder? So, to be clear, the husband and the wife are carriers, but not necessarily um, affected by the disorder. Cystic fibrosis is an autosomal recessive disorder, which means that in order for the child to manifest the disease, they must inherit two defective copies of the CFTR gene, which we talked about earlier when we talked about translocation. So one from each parent. And the probability of the child inheriting the disease is independent of their gender. Okay, so it just happens to be a son in this scenario. So we need to look at the genetic cross. Now, if both parents are carriers of the genotype capital FF, so the capital F is the normal allele, and the lowercase f is the mutated allele. And it's the mutated allele that causes cystic fibrosis. If both parents are carriers, this is termed to be heterozygous. Now, looking at the Punnett square is going to help us to understand if their genetic contributions are going to cause cystic fibrosis and to what degree. So according to the Punnett square of the genetic contributions, 25% chance of the normal allele meeting the normal allele, and the child will not be a carrier. There's a 25% chance also that the child will be affected by cystic fibrosis with two abnormal alleles. 50% chance of the child having a normal allele with an abnormal allele. They'll be a carrier, but they will not be affected. And this is what's happening with both parents right now. So then the question is, what is the chance for a son to be affected by cystic fibrosis, or their son specifically? Well, first of all, the chance of having a son is about 50%. The cystic fibrosis risk then of inheriting the two abnormal alleles causing and being affected by cystic fibrosis would be how many percent? The chance of inheriting it, according to the Punnett square, is 25%. Now, looking at the possibilities independently, the overall likelihood of having a son, though, affected by cystic fibrosis, we'd have to take the 50% or the 0.5, multiply that by the 25% or the 0.25, which gives us 0.125. Convert that back to percentage, and you have your answer. There's a 12.5% chance, or 1 in 8% chance, that a mother and father, carriers of the cystic fibrosis gene, would have a son affected by cystic fibrosis.